Hello everyone, welcome to AY Tutorials. This is the part 2 of capsules. Problems and remedies while manufacturing the capsules. First one is deliquescent or hygroscopic powders. This hygroscopic means these are the substances which absorb the moisture from surrounding, and when deliquescent or hygroscopic materials is filled in the capsule, then it absorb the moisture from the shell and it make it brittle and may leads to the hydrolysis of API, that is active pharmaceutical ingredient. And remedy for this is the addition of absorbents like MgCO3 and MgO. The adsorbents will absorb the moisture itself and hence prevents the hydrolysis. Second one is the eutectic mixtures. Eutectic mixture is a mixture of substances having melting point lower than that of any of its components. If we are having 2 to 3 components in that capsule, and if one component of them is having the low melting point, then that is known as eutectic mixture. When such a components are filled in the capsule, they melt within the capsule, and this may alter the stability and desirability of the capsule. And remedy for this is we can use the adsorbents like kaolin, MgCO3, and can solve this problem. Next one is the small dose of the drug. This problem may arises with the potent drugs because it requires very less quantity of API. This might not be sufficient to be filled. If that drug is having the low dose, then it is known as the potent drug. So in this kind of things, this small dose of the drug problem can be occur. And remedy for this is the addition of inert powder, diluents, or use the small size of the capsule shell, for this instance 5. Then incompatibilities of the materials. When two or more active pharmaceutical ingredients or the excipients are not compatible with each other, they may lead to any physical or chemical incompatibility. Means chemical changes will be there at that point, and which leads to the therapeutic failure and poor patient compliance. And remedy for this is microencapsulation of those APIs with the inert coatings. Then particle shape. The shape of the particle influences all the stages of the powder handling. The shape of the particle is very important. For the capsule filling, most critical particle shape is the needle or rod shape. And remedy for this is the granulation of such a material is the only successful approach to overcome this problem. Sometimes the addition of excipients with the roundish shape of the similar particle size also be proven very useful. This particle shape is very important, and in case of the rod shape or the needle shape, at that time we can go for the granulation and this problem can be solved. Quality control test for the capsules. Here I have enlisted these points: appearance, size and shape, unique identification marking, assays, content of active ingredients, then content uniformity, uniformity of mass, mass variation test, disintegration test, dissolution test, and moisture permission test. Let's see what is the definition of soft gelatin capsule. A soft gel or a soft gelatin capsule is a solid capsule. It is having the outer shell which is of a solid state surrounding a liquid or semi-solid center. That is, inner fill will be semi-solid and outer shell will be solid in nature. Manufacturing of SGC or filling of SGC. SGC stands for soft gelatin capsule, mainly done by 4 methods. First one is the plate process, second one is rotatory die process, third one is reciprocating the die process, and last one is the aquagel technology. Rotatory die process. In this process, this is the continuous and automatic capsule filling process. 2 continuous sheets of the gelatin will be there, which is supplied to the 2 die rolls. Both the die rolls, they are having the matching number of the dies. Both the die rolls, they will rotate at the same speed in the opposite direction. And medicament tank, which stores the blend of the ingredients which are about to fill. It is known as medicament tank. And metering device, it controls the rate of the filling as well as the dose of the active pharmaceutical ingredient. As a gelatin sheet come in between that rolls, the material will be filled and they will be injected through the metering device, and the pressure which will be exerted by that material forces the gelatin sheet to go in the cavities of the die, which forms two holes of the capsule and fill them. The following things should be monitored or controlled: gelatin temperature, fill temperature, ribbon thickness, seal or seam width, and fill quantity. Quality control test for the capsules. First one is the physical test of capsule. The soft gelatin capsules, they are tested for physical integrity, if there is any leakage or not, by the visual inspection only. Similarly, the hard gelatin capsules will be tested for the breach of the physical integrity, that is breakage or open cap and body for that manner. Then capsules diameter sorter, it will allow us to pass the next uniform capsule within the suitable range of the diameter. Capsule color, any capsule whose color does not conform to the reference color. This kind of things should be test in case of physical test of the capsules. Then content uniformity test. Take 30 capsules and select 10 capsules randomly amongst them. Then analyze 9 of the 10 capsules which should be in the range of plus minus 15%, that is 85 to 115%. If not, then remaining 20 capsules should also analyzed. Test passes if all the 30 capsules are within plus minus 25%, that is 75 to 125%, and not less than 27 of the 30 are within the 85 to 115%. Then disintegration test. The disintegration test, it determines that whether the capsules will disintegrate within the prescribed time or not when placed in the liquid medium under the prescribed integral conditions. We will go for that integral conditions and we will test that capsule in that environment. Introduce one capsule in each tube and suspend that apparatus in a beaker containing 60 ml of water at 37 degrees Celsius. Net weight of the drug is equal to weight of the intact capsule minus weight of the empty shell. Capsule passes the test if no residue remains on the screen after prescribed time. The ideal range for the HGC will be 15 to 30 minutes, and for SGC, that is soft gelatin capsule, it will be 60 minutes. Dissolution test. This dissolution test is official in both USP and IP, and it is conducted using the basket apparatus. The capsule is placed in the basket and then basket is immersed in a dissolution medium, and it will be rotated at the specific speed, that is 100 rotations per minute. This dissolution medium, it will be held in the covered 1000 ml glass vessel and maintained at the 37 degrees Celsius by means of the constant temperature, which will be suitable water bath. The stirrer speed and the type of dissolution medium are specified in the individual monograph. Then stability test, it will be accelerated stability study. Temperature will be 40 degrees Celsius and humidity will be 80% RH. Then moisture content, it will done by toluene distillation method. Collect the distillate and remove the water by heating. For hard gelatin capsule, it will be 12 to 16%, and for soft gelatin capsule, it will be 6 to 10%. Then others are seal thickness determination, capsule rupture test, and determination of freezing and high temperature effect. Here we are done with the part 2 of the capsules. In this video we have seen the various problems which are there in the manufacturing of capsules and the remedies to overcome that problems, and also some quality control test for the capsules. If you like this video, please do like, share and subscribe. Thank you.